Hi everybody, this is Hispanic Speak Out. I'm Jose Miranda. I'm co-host along with Danny Ramos. Danny has a night off and we hope that he gets back soon. Okay. Today, there's a lot of things going on. Of course, I have a rant I want to talk about. We're being joined today by Josephine Mercado, who is an advocate, who is been here since 1999.
That's right.
Right, and a warm welcome. How are you?
Thank you.
Welcome
Thank you.
to the show.
My pleasure to be here.
Okay. One of the things I want to get into real quick is about the vote. And it's important that everyone, white, black, green, blue, you have to get out and vote. You can't make change unless you get involved. And you can't get involved if you're sitting on the sofa watching a novelas. That'll be soap operas to some, okay? And you can't get it at the club at night while you're partying, or you're smoking pot, or you're enjoying whatever other things that you might want to enjoy in the great Floridian area, or beyond a scope, you know, and on the internet as you view us and think about the things that we do here in Florida and across the nation. It's important. The vote, and it's important because we know that there are rules and roadblocks that are being presented and put up there to prevent you from having a vote, to prevent you and me from having a say-so in our government. And when you want to circumvent something, when you want to make sure that your party or your voice is heard over the other, how do you do that? You do that by making legislative change, by making it difficult for the other guy to vote. And the more you do that, the more you constrict the people coming out and having a voice. And then when you decide that you need a voice, your voice is gone because it's passed. And now you're at the mercy of whoever's in charge. And we can make a difference. And you got to understand that. We, the people, you and I are the people. It's not we and the government. The government works for us. It's hard to see that lately, but we have to make sure that we put the people in there that need to listen to us. And it's hard to do when you're a millionaire or a billionaire to try to find out how my life is at $50,000 a year. Real difficult.
Right.
Okay.
Mm-hmm.
The other thing that's out there is the healthcare issue, and we have a healthcare issue that provides for existing illnesses, which we didn't have before. We're at the mercy of the insurance companies who could just throw you out at will. If you think that's not an important issue, what if your child had leukemia and needed an extra pill that cost $10,000, and your insurance company decided you didn't need that extra pill because your child wasn't worth it? Is it okay with you that lovable 2-year-old you're looking in their eyes, your baby? How about if it was your wife? How about if it was your girl, your grandmother, your significant other, your person that you love? And one pill is the difference between living another breath. How many of you have lost people already that you wish you could have one more minute, 1 second more to say, I love you? And an insurance company is going to tell you no. Sounds a bit dramatic, maybe. But it happens every day in this union. And it's politics as usual. People are dying while people play politics, while they push the donut down the road. And they're comfortable because it doesn't affect them. You recently had a Republican legislator go against the norm when his child was in a mix where his decision could have made her life and death. And he saw the light. But people in his party are holding it against him and are trying to out him in his seat during the election. So it's an emotional thing for me too. Okay, it involves me, it involves you, and it should involve every single swinging person out there. All right, so get involved, wake up. This is important, and this is why we have advocates that are running for office. That we need real substantive people, and that's what we need, and that's why Ms. Mercado as an advocate is such a strong person to have here, as well as our previous guests that we've had that speak to the issues at hand, that we need change. And don't tell me just because we can't do it today that we can't have that change. Change isn't about something that happens immediately. Change is about a state of mind. If you can't have the state of mind, then you might as well just sit there and suck on your thumb. Eventually, life will open the door for you. So we have an Affordable Care Act that was put into play. You have been advocating for the longest time for positive change, for the equality of the system, to have people, all people involved, but especially Latinos to be involved.
True.
We have language issues. We have trust issues. Okay, we don't trust the system. We don't even trust you when you come to us and say, you know, like, I can show you how to do something. I go, well, why should I bother? As a Latino, perhaps I have papers, perhaps I don't. I don't have as a figure on television here. I don't have the wherefore as our governor does, where apparently all the undocumented immigrants call him and let him know how many of them that are here, taking away the jobs and of course taking away the Affordable Care Act. So I think his numbers are somewhere in the 700,000 number. Mm-hmm. So, but they call him directly so they can be put on the list, and so that he's aware of how many illegal people are coming into the system. So. How are you going about making the changes for us?
When I moved here in 1999, I moved here from New York City, a city where social services and health services for the underserved, the poor, and the uninsured are abound. And when I moved here from New York in 1999, I was very, very surprised to see the lack of health and social services that existed here in Central Florida. Mm. And I was lucky enough to find a couple of other people that made the same observation, and we together decided to do something about it. And you're absolutely right. Change can be accomplished if you have people that have a vision, and our vision was this was not right. There are some things that we can work with and work towards helping our community, and the healthcare system was one of those things that we wanted to be more involved with. One of the things that we noted was, for instance, we were preparing a report on the health status of Latinas residing in Florida, and we set out to look at domestic violence, high school dropout, teenage pregnancy, and breast cancer. There were absolutely no statistics on Latinas. It was not that that information was not being collected. However, we were being classified either as white or non-white. And as everyone that has been working in the health system knows, one of the ways that you identify the need is by looking at the population as not a group effort, but the population. The specific ethnic group is important. The specific racial group is important in order for you to determine what the needs are. And we decided that we could not just sit by and take that reality as a given, that we had to do something about it, at which point we formed this organization.
Why is it that we're still being counted as non-Hispanic, or is it non-Hispanic or non-white?
It was either, to my understanding, it was either with the African American group, it was racially. Right. We were divided racially, not ethnically. Right. And as a result, we were either in the white Caucasian group or in the African American group.
So then in order to find true numbers, you have to go and look in both sides in order to pick out the numbers.
And find whether or not that person was a Latina, right. Which we were not going to do that. We did prepare the report, by the way,
Right.
but that also pointed out the truth that we needed to do something that would really focus on our community. Our concern was that if no one had been focusing on us as a group, how will they know what our needs are as a community? How many are suffering with breast cancer? How many need breast cancer education? How many are diabetics? How many need education on prevention on diabetes? So we decided to do something about it, and it was a grassroots group of Hispanic professionals that put Hispanic health initiatives together. The group, actually, this whole thing started, believe it or not, in my apartment. And today, 12 years later, I'm happy to say we have our own office.
Good.
And we're doing very, very well insofar as reaching out to the Hispanic community. We're getting ready now to reach out to the African American community too.
And I might add that your organization is basically run by volunteers.
It's a volunteer-driven organization, and that's the only way we could possibly operate in the 4 counties that we work in. We work in Orange, Osceola, Seminole, and Volusia. And it's the community, basically, they are the heart and soul in that area, where we go in and we find out that this church is willing to help their members as well as the community by allowing us to go in and do a presentation on a health topic or do a health risk assessment. We have a health risk assessment program that is exceptional, and many people are able to control or prevent some of these chronic diseases if they get the education and prevention information that we provide.
Well, let's get to some bottom lines here. Are we saying that a majority of Floridians are without insurance, or are we saying that a majority of Floridians don't have insurance, but in addition to that, there are more Latinos without insurance?
We're saying everything that you said is true. Regrettably, the largest group nationwide without insurance are Hispanic. That is the truth. Nationwide, it is stated that it's over 30% of Latinos have no insurance at all. And in our state, especially in this area, I would say, that's like 60%. And the reason why we state that it's more like 60% is that many of the Latinos work in the service industry. They are working sometimes part-time, in which case they do not qualify for insurance. Those that do work full-time are offered an insurance package that they would have to contribute maybe $400 a month. They cannot afford that, so they turn it down. Others are insured. However, their deductible is $2,500. They cannot afford to go that route unless they're severely ill, like a catastrophic situation. Right. So they also do not really use their insurance. So when you count the medically underserved and you count the uninsured and the underinsured, over 60% of Latinos residing in this area are basically, quote unquote, uninsured.
I've heard it said by certain political parties that the only reason that these people are underemployed or not working is simply because they're less lazy. They want the system to take care of them. Well, based on your involvement in the community, how many people have you found that just want to just sit down and want the government to kind of help them out and just provide for them?
We have not come across. I am very proud to say we have not come across anyone that has been a laid-back type of person. Most of the people that we wind up seeing are victims of the system. The health system for the longest time has paid attention to treatment. In other words, let's wait until they're sick, let's give them a pill or whatever, and by the way, research, find a cure. They have not been paying attention to education and prevention. No one wants to be sick. If you educate them on how they can stay healthy, if you give them the opportunity to go for preventive type of screenings, where they can find the problem early if they have the problem, or perhaps avoid the problem, they will do that. And that's what the Affordable Care Act, that's one of the major things of the Affordable Care Act. There's going to be a lot of opportunities for everyone, and I mean children, women, Medicare recipients, you name it, for everyone to get education and preventive screening.
Well, let's understand also with the president's initiative that yes, a lot of people will be covered. We're also going to be leaving a lot of people behind, and that's going to call for some sort of other action on our part or on groups like yourselves to kind of get the rest of the group in so that everyone is covered. And again, if you have your health, pretty much the rest of life can be pretty decent.
That's very true.
Right?
Health is your greatest asset.
Right.
People don't realize it. They think that it's money. They think that it's that car, that it's that house, that it's education. Yes, those are assets, but without health, you can't enjoy any of them, or you may not even obtain any of them. So health is really, and should really be, their number one goal. Good health. And quite frankly, you're right. There's going to be a number of people that are not going to be covered with this package. But what we're hoping is to have a healthier society where people would begin to learn how to stay healthy and live longer and more productive lives, by the way.
Okay, let me be the devil's advocate. If my behind lives longer, that's going to cost somebody more money somewhere. An extra pill,
well,
an extra hospital, maybe not. But should the goal here be that you shouldn't live as long?
No. You know, what's sad with our health system is that a lot of people are not aware that we have the costliest health system in the world.
Yeah. $50 for an aspirin, I'd say it's kind of steep.
And the results are the worst.
Right.
Our impact on the problems of chronic disease are atrocious. We have not really begun a dent on that issue.
So what do we do?
Well, with education and prevention is one of the bigger steps. It is hoped that through the changes that's one small part of the Affordable Care Act. The Affordable Care Act is, you had mentioned it earlier, is very true. It's going to put an end to a lot of the abuses in the health system that have driven the cost of health care to where it's at today. Therefore, doctors, hospitals, they're going to have to be more accountable for the care of their patients. It's not going to be a case where you're going to continue giving that person a pill and increasing the dosage and increasing the dosage. At some point in time, the government is going to ask, someone is going to ask, why isn't this person getting better?
Okay.
Should we be paying you to continue raising that person's dosage? Or should we be looking into how you're treating them and getting them to get well? And the same thing is going to happen with the hospitals. The hospitals cannot continue discharging a person that's going to come back in 2 weeks. That's going to be looked into also. The issue of Medicaid and Medicare fraud, that is going to also be dealt with very strongly. So there are all sorts of protections that are going to drive the cost of health care down.
I remember in the last presidential race when the Republicans indicated that the Democrats wanted to send up to create death panels. Okay, in the system that you're advocating, where you want to find out why this person continues to get the same medication and shows no improvement, and now somebody else has to step in and say, oversee this. Can this be construed as a death panel?
No, absolutely not. Okay. It's going to be an improvement, a marked improvement in the services, in the quality of services that you and I and others are going to receive. That's basically what they're looking for. It has nothing to do. The death panel issue is something that was made up. It's one of the fear tactics that have been created along with other fear tactics by those that are in opposition to the Affordable Care Act. People need to remember this is a law to protect the consumer. The first part of that law is Patient Protection Affordable Care Act. And for some reason, patient protection is often left out. Patient protection, people need to realize who are the patients. It's them, the consumers.
Right.
And this is intended to protect them. And having a death panel, that's no protection.
Well, I use that because I remember those concepts of someone else asking why this person is doing this. And so can that person at the same time say, we're going to stop this? And that would create a fear that we already have out there, because we have a fear where people are fear-mongering, basically saying that, first of all, they're going to cut all the Medicaid and they're going to cut all the Medicare, because it's just consuming monies, and we can't afford that because we have to have money to have wars, of course, and we have to have monies to create other things, and so it becomes an issue of money. In order to create these systems, especially you want systems that are going to take care of families. And if you're saying, as you mentioned, that a majority of Latinos are underserved, then what do we do, or how do we create the monies to take care of those?
Well, what will happen is that eventually the system will start to take care of those that do remain ill and cannot control the disease and so on, because there will be more people that will receive preventive medicine or that will be educated enough. Something as simple as nutrition and exercise. People need to learn what healthy nutrition is all about. People need to know what a regular day exercise should be like, because simply speaking, nutrition and exercise can prevent and control almost all the chronic diseases that are out there. People need to learn that, and they need to learn that before they get sick, not when they're sick.
I'm always afraid when we say the Affordable Care Act is actually a little bit in place. It's starting now to take care of things. But as we go forward, there's still going to be a segment of people who are going to say, if I gave you nothing to take care of yourself, would you as an individual now go out and seek a way to take care of yourself without my assistance? I mean, without government assistance?
Probably the emergency room, which is what's going on right now.
Right, where a majority of people are uncovered.
You will wait until the last, you cannot withstand whatever that is, pain or whatever, and you'll go to the emergency room. And it's more costly when you go to the emergency room, not only to you and your pocket, but to the hospital, to the insurance companies.
We all pay for it.
That's right. So the question is, when do you want to pay? Before the person really gets sick? So teach them how to stay well, teach them about prevention, or you want to pay later when you have to amputate or do who knows what in order to try to keep that person alive.
Now, there's also issue of young people, younger people. I'm not sure the age, let's say from 20 to 40, for example, who are young, energetic, employed, most of them probably employed, and feel that there's no need for insurance or to care about anything at this point. How do we address them? Because that seems to be a big bunch of folks in there that people are concerned about, that are frivolous at this point.
Well, what they need to also realize is that they're not going to be young forever. At some point in time, they're going to be 50-something, 60-something, and will probably begin to suffer with some of the diseases that come with age. And it's better for them to plan now on getting the system the way it should be, the health system, than to leave it the way it is. The health system cannot sustain itself if it continues like this.
No,
I really do not know what's going to happen if the Affordable Care Act goes away, but we're going to have a lot of seriously sick people walking the streets.
Now, what about the issue that this year that you've heard in some of the Republican primaries, where the question was, a young person was ill. A young person was healthy, didn't want insurance. Suddenly got ill by a catastrophic thing, and when they asked one of the candidates, the audience responded by "Let them die." Do you think that's the issue? That's what a majority of Americans want? Just let them die?
I could not believe that I heard that. I know which candidate you're speaking of, especially in a quote-unquote civil society that we supposedly live in. To me, health is a human right. Of course, there are some countries where they're very, very poor and there's just so much to go around, and what goes around is very little. But we don't live in that country. This is not the United States that I was born in or the United States that I was raised in. We have grown very, very callous for each other. That's not what I am all about, and that's not a country that I could be proud of if it continues this way.
How do we reach you? How do we keep in touch with you?
Well, our organization is going to be hosting a health fair on May 5th. Our telephone number is 407-339-2001. That's 407-339-2001. And we're going to have all sorts of free examinations.
Oh, great.
Sometimes this is some of the people that attend, this is their annual exam.
We're going to get Danny to get out there.
Yes, we want him there. We would love to have him there. And they can call us at our office. We have all sorts of activities. We have the health risk assessment program. Everything that we do is free. And we connect people with the free and low-cost clinics and medical services that are out there. And we advocate, of course, for the Affordable Care Act because we know this is a big step in the right direction insofar as the health system. It's not a panacea. It's not going to correct everything, but it's a start. We can begin to amend what's in there. Before, we had nothing to amend. Now we have something.
Outstanding. We want to thank you, Josephine, for taking the time.
Thank you for inviting me.
I appreciate it so much. We have to have you back so we can talk some more.
Sure, I would like to come back after May 5th.
And let's keep on this because the Affordable Care Act, we'll know more about it in June.
Yes.
And hopefully they won't gut it too badly, and or they might totally agree with the President of the United States and decide that that would be wonderful. That's the thing that we need to do. Remember that Hispanic Speak Out is here to speak about community issues, things that affect us each and every day, about the Latin family, about the way that you can learn about Latinos and that you realize that we're just like everybody else. We put on our pants backwards, apparently, in some instances. We have very intelligent people, wonderful family guidance. It's not the typical things that you might see on TV that sell sensational. Our families are just like everybody else on their family values. They sit around the table, they do all the things that are wonderful and important to all of us. On behalf of Danny Ramos and the program and all our affiliates and the things that we do together, and don't forget about the license plate. I'm sorry I didn't plug it appropriately. Hello. For our plate that can be had all over the place. Come back next week and we'll talk some more about what's going on in the community. I'm Jose Miranda, and this has been Hispanic Speak Out.
Bye.